Good morning, ladies and gentlemen. It is my great pleasure to open the Crisis Management and Disaster Response Center of Excellence new initiative for online discussion of the burning issues that raise a significant amount of questions nowadays. It is no doubt that the top public interest today is the impact of COVID-19 on the different aspects of the society lives. That's why I will start our first live discussion with one of the most experienced person who works actively on that issue and since the very beginning explored the effect of the pandemic on the military activities. It is my pleasure to present Professor Rostislav Kostadinov, who is Vice Dean for International Relations and Project Activities of the Public Health Faculty in the Medical University of Plovdiv and Secretary General of International Disaster Medicine Association in Naples, Italy. He graduated medicine at Plovdiv University in 1991 and joined the Bulgarian Armed Forces. He worked in the military medical detachment for emergency response, developing an interest not only in the clinical aspects of military and disaster medicine, but also for the organizational and managerial challenges. Dr. Kostadinov was assigned twice at NATO Joint Force Command in Naples. Since 2015, he is not an active military, but still works in the area of the military medicine. He has been invited as a visiting professor in disaster medicine in University della Campania Luigi Vanvitelli in Naples, Italy, and he is an author and co-author in 18 books and 90 studies published on international and national scientific events. Invited as a key and guest speaker on many international scientific events and guest lecturer in NATO School Oberammergau and George Marshall European Garbage Partenkircher. With no further ado, I give the floor to Professor Kostadinov. Professor Kostadinov, welcome again in Crisis Management Disaster Response Center of Excellence. Can you hear me well?
Yes, I can hear you, Director, and I would like to express my gratitude for
of questions for you. Hope that and from the auditoria you will have additional questions. But let's start and not lose time because we have only 40 minutes for that fruitful discussion. Coronavirus again. We have witnessed a lot of controversial statements and publications those days. Do we have a clear vision regarding the virus and its impact on human health?
oh, that's a great question. releasing the strict measures, we are witnessing a new wave and a new increase into the RO. Why it is? Because, unfortunately for us, for all the virus proved to be a real stable into the environment. It is proved till now that he could remain viable into the environment till 7 days, especially into the especially onto the steel and plastic surfaces. And we know that the plastic surfaces are all around us. What is more, its viable virus is 7 days, but he could transmit the infection if you touch this surface till 4 days. So we have a huge period. And what is more, the spread of this virus could be not only with airborne droplets, as it was thought into the beginning, but it could be spread and via air, via forming. So we are not protected against the virus spread. And all this contagions, all this stability is leading to an increased risk for the population. I will say that is a biological threat. This is our main concern into the medical community. Could we stop the virus? How we could stop the virus and what we could do? And in accordance to these issues, we are assessing the health risk. And nowadays, it is almost anonymous between us that the virus is not a high risk, it's a real biological threat. I do not want to appalling our audience, but the measures, the preventive measures are a must. Because the virus is within our population, it is on the surfaces, it is surrounding us. This is what I would say regarding the virus and its presence nowadays throughout the world.
Thank you, Professor. Thank you, Professor. Yes, we are on the same opinion that it is obvious that the pandemic situation is a source of a great risk for the society. Even now, we are forced in the situation that we don't know how it will be continue spreading of the virus and what will we have. But you also describe the risk level as a threat. I fully agree with you, but could you explain to the audience why this is we can think that this is a threat?
Oh, thank you. Please allow me to enter into some details regarding the disaster medicine. Because when we are assessing the health risk into the disaster medicine, we are observing mainly 4 levels of threat. And the most risky, the highest level is biological threat. What does it mean, threat? In accordance to the disaster medicine, the threat is such a risk level when all the risk factors are present. And if we implement all the available preventive measures, we could not stop the disaster to occur. What is more, all the preventive measures are only decreasing the severity of the consequences. So what does it mean into more simple words? That we do not have a possibility to stop the disaster to occur. Do we have an evidence for this statement that the coronavirus, the SARS COVID-19 is a real biological threat? Yes, we have, because notwithstanding the very strict measures all over the world, what we are observing, till today, about 14.5 million people because what I want to point out and to highlight is that those that are with mild, I will say light or without any symptoms, they're spreading the infections at least 8 days, and no one of them knows about it. This is the important. So we could not stop the spreading of infection because of this great majority of asymptomatic patients. What's more, if we're implementing the measures, what we need a protective equipment, and protective equipment to protect entire population. There is no country with such a reserves till today. What is more, what we have witnessed still into these 7 months is that the healthcare systems were not prepared, and they faced a serious shortfall into their response. What I mean, a lot of medical personnel were infected and were out of duty. And what is of utmost importance till today? We do not know how to treat the consequences of the infection. And if we do not know how to treat properly the virus and the consequences, how we could eradicate it, how we could prevent the disaster to come. And despite of all this, I will say positive news regarding coming from Russia, from England, from China, for the vaccine development, we're still into the trial phase. So into the coming 4 to 5 to 6 months, we could not expect to have a real barrier, a real protection against the virus spread. So this gives me a reason to state that the coronavirus is a biological threat. We cannot protect ourselves, we could not stop its spreading. Therefore, what we are trying to do now with the strict measures is only to reduce the severity of consequences. This is why I'm 110%, if you allow me to say like this, I'm confident that till today, till now, and within the coming months, the coronavirus will remain a biological threat for all societies all over the world.
Absolutely agree with you that threat we should finish only when we have a right vaccine and right treatment. Healthcare systems. You mentioned about the healthcare system. The biggest challenge for us is about exactly the healthcare system to keep it on the right level. We know that the healthcare system worldwide have been overstretched into the beginning of the epidemic process. It's I know that it's a different level in different countries, but what is their level of resilience of the healthcare systems? You mentioned that in some systems, even the medical personnel is already ill and treated by the virus. In some countries, the healthcare system are not on adequate level, but could we make some kind of general, what is their level of resilience on the healthcare systems?
Oh, dear director, this is a real tough question. Now I'm confused. Why? You're asking me about the resilience of the healthcare system, about their readiness to admit, to cope, and to restore their functionality against the external threat. Do we have an example for healthcare system that was resilient? Unfortunately not. Why? We have witnessed something that is example to the entire world, they were forced to kneel in front of this small virus. What I mean? They were no plans regarding the amount of resources required for protecting of medical teams all over the world. What is more, we were not prepared from the scientific point of view how to manage this new threat. We lost months into the beginning in arguing which is the source, how the virus spread. We lost these months because these months were needed to enter into the pathophysiology of the development of the consequences of this disease. And at least we learned very hard our lesson. We really needed a military to intervene into the civilian healthcare systems in order to put these systems functions in order. But even with the intervention of our well-prepared CMDR team, with our well-prepared medical teams, what we observe nowadays, the systems are on the edge of their capabilities. I am not speaking about the rooms, about the beds. It is very easy to establish a field hospital with 200, with 1,000, even with 5,000 beds. It's not a problem. We have seen that into 2 months, our respirators, our ventilators were produced and were deployed. I agree, but what is needed here, it's a workforce, because unfortunately the beds, unfortunately the ventilators could not operate alone. They could not treat the casualties. And what we are observing that the workforce that is with implied task to protect, to save the health, and to restore the public is almost exhausted. We are observing thousands of medics that are coming infected and they're exiting from the front line. What is more, we have a lot of fatalities into the medical ranks. I'm speaking medical ranks not for the military medical, I'm speaking for the medical community. And why it is? I could give some assumption on this, because we're still arguing what caused these problems, what broke, what have broken the resilience. First of all, the age of our consultants, the age of medical community. All those that are above 50s are vulnerable. Unfortunately, in order we to have experienced medics that are required for this new coming infection, for this consequence, they are above 50s. They need a time to get experience. But they're vulnerable and they're getting very fast out of front line. This broke the resilience, the age of medical community, the lack of resources, the lack of protective equipment, and what is most, and we are still observing this nowadays, and this is a pity for us, the lack of training of our colleagues, how to protect themselves, how to protect the patients, how to protect the infected people. These are the main three still not solved issues into the medical healthcare system resilience.
Yes, you are right, and I believe that even not in every one country the treat and education and training not only on the civilian personnel and medical personnel should be the same quality. And from that point of view, all countries have taken their own national approaches for crisis management. Could we expect that the pure national restrictions, preventive measures, will mitigate sufficiently the virus spreading and lead to epidemic eradication? And also, what are, from your professional point of view, the most appropriate course of action in that direction?
Directly, you're putting me into a real trouble. Because, on one hand, if we have already allocated, already established and developed biological area of damage, the rule from centuries, I will say from thousands of years, that is proved to be efficient into the epidemics eradication is to close the area, to stop any one of exiting and to stop everyone of entering into this area. What does it mean? We have to localize, we have to quarantine, and we have to stop movement from in and out of the biological area of damage. This is what is needed into the biological area of damage. But on the other hand, what I said into answering your previous question was that no country has sufficient resources. No country has sufficient sufficient equipment in teams to cope with this threat. What is more, in contemporary world, we are traveling. A lot of our compatriots are out of our borders. Would we deny the entrance of these our compatriots if they want to come into their homeland? We will violate their civilian rules. And now this is the dilemma. On one hand, we have to stop any movement. We have to block the biological area of damage in order to eradicate, to decrease the RO. But from the other hand, we should not violate the freedom of the movement and the freedom of the personnel, of the people. So where is the solution? We have seen, we have witnessed that into the beginning, the infection was localized and stopped into one big province, I will say great amount of people into the China. And they were not spreading of the virus all over the world. What happened? A lot of governments decided to move their citizens out of the area of damage, and the spread began. And now we have a pandemic. So, where is the solution? I have no clear answer to this. But the most important is to restrict, to stop, if we cannot stop, to decrease the movement. But what we have witnessed, even nowadays, for 5 days, our leaders into the European Union, they met personally. What they did, most probably they spread the infection from between them. Let's hope that is not. But from my point of view, this is a mistake. Till the end, till the RO below 0.5, we should not permit all these movements between the countries. We should make these corridors for transferring goods, equipment, teams, but only this. But nowadays we are observing a tourist to be alive again. And what we're witnessing in Bulgaria, in Spain, what we're witnessing, fourfold, threefold increase into the infected person population. And this, unfortunately, from my point of view, I do hope that I will be back clairvoyant, but from my point of view, this will lead to a new wave, to a new peak of numbers. This is my vision regarding the problems with the transportation and the movement of the patient, of the population.
Yes, thank you for that answer. But I would like to continue in that direction because the movement is very important, and we saw that a lot in some countries the fluctuation of the disease of the fluctuation of the virus is not predictable actually. Even in some country, for example, in Israel, they now are thinking how to involve the armed forces to manage with this threat, the virus. In several countries, the armed forces were already involved into the pandemic response. Could we assume this as an evidence for civilian disaster management system vulnerability?
I think that I have answered this question because all the countries experience breaking resilience. And I will say that all over the world, the armed forces were involved. You gave an example of Israel. No, it's not only Israel. A lot of countries started a real military operation for coping with the coronavirus epidemic in their countries. I will give an example. UK, they deployed 20,000 servicemen and women into the COVID task force. I will give you an example with Spain. They started an Operation Balmis, deploying 2,500 servicemen and women to support. Operation Resilience in France, in Italy. All the countries involved the armed forces. How the armed forces were involved? In many aspects. One of the first lines of their involvement was into the localizing and safeguarding the biological area of damage. Our colleagues, I will say our because after 25 years of active service, I'm still thinking as a military medical doctor. So our soldiers were supporting the law enforcement, the police, the gendarmerie forces into countries, into making the cordons. They were assisting into the cordoning, into the quarantinizing the people, even from the airports. The Japan included the armed forces into setting the quarantine for the arrivals. What else? A lot of armed forces are involved into the logistics for the repatriation of the compatriots, for the transportation of goods, for the transportation of equipment to the affected folks. What else? We could say that the militarists are part of the first responders in all of the countries because no country was prepared for such a huge increase of the demands. Therefore, I will give later on some examples how the armed forces were involved, but the most important was that into the heat of the pandemic, the civilian systems capabilities that are well developed into the armed forces. What I mean, coordination in information centers. The armed forces are providing these very significant, important capabilities regarding the coordination, information, regarding the command and control, regarding the tracking and monitoring, regarding the logistics. And of course, when we're speaking about the involvement of the armed forces, a lot of the countries were expecting and they received medical support for their almost cracked memorial healthcare system.
Yes, I completely agree with you, and we already mentioned about the military medical teams, but I would like to clean up exactly what is the role of military medical teams. When you mention about the using of our forces, every one of us believe that one of the most important things on the military armed forces is to provide that kind of capabilities in the army, military medical teams. I completely agree with you that that is not the only thing what the armed forces could help to decrease the spreading of the virus, and especially to help on the to control the situation in the countries. From our point of view and our analysis in the Crisis Management and Disaster Response Center of Excellence, we believe that the military assets can help to the governments to keep the control of 3Ds, what mentioned, the discipline, the distance, and etc. But let's stop exactly what is the role of the military medical teams into this coordinated efforts. Are military medical services ready to respond adequately and efficiently?
Now, could I split your question into two parts? The first one is how the military medical services could enhance the healthcare system's capabilities and resilience. And the second is how we prepared to perform these duties. Now, while analyzing the published articles, we could give several topics where the military medical services were involved. In most of the countries, I will say in all of the countries, they were involved into decontamination procedures because into the first weeks, the decontamination capabilities of healthcare systems were crushed. So our CBRN medical teams were involved into the decontaminating not only hospitals, but the residential areas, the schools, and etc. What is more, the military medics were involved, were asked by great majority of the countries to start establishing a field hospitals. Okay, the logistics and the establishment of field hospital is not a great deal. But in most of the countries, the military medics have to enter into the real disaster medical support, establishing and working into the trash centers in front of the hospitals, because our colleagues, civilian colleagues, really needed into the beginning of the pandemic to understand what exactly the triage has to be, where this triage has to be accomplished. Unfortunately, I have a lot of evidence where the triage areas were inserted into the hospitals, into the EDs, emergency departments. It is a mistake. A lot of hospitals were closed because of not appropriate triage of the casualties. A lot of systems were moved between the hospitals, spreading the infection from one to the other hospital. So therefore, the medics, my colleagues, into the biological area of damage. But this was not sufficient. A lot of districts, a lot of provincial hospitals all over the world were full, became full. They were overstretched and they could not admit even a single patient. What was needed? Again, the military medical service helped to the civilian, opening the military hospitals for admittance of the COVID patients. What is more, a military medical teams were sent to the civilian hospitals to enhance their capabilities regarding the reanimation, regarding the anesthesiology, regarding the infectious disease control. The medical teams were inserted and started duties, shifts into the civilian hospitals. But I think that the greatest impact of the military medical teams is into the scientific approach, because our laboratories were first to identify the difference between the strengths of the virus available nowadays. They are still monitoring, and I will say that the two most advanced developments into the vaccine are again with the made, I will say, not only with the support, but they are clearly made by the military medical scientists. I'm speaking for the China vaccine and the Russian vaccine that are on the third trial. They were made by the military medical physicians. They started, and afterwards they spread the knowledge. What else I would say? That the military medics were involved into the whole treatment and evacuation process, because several military ambulances started a medevac, I will say ground or air medevac, or even a train medevac that we have witnessed into the France. So the military medical capabilities were involved into all the processes of the management of infected patients, infected casualties. Now, the second part of the question. Are we, military medical systems, are we ready to confront, face, to deal the new way? I will say, I'm in doubt. I'm in doubt. I will say we are not, because what we are observing nowadays, most of the infectious diseases departments or hospitals that are under military medical governance are almost full. They are working into the 60–70% of their capacity. But the problem is with the workforce. Because every one of you, the not medical servicemen, when we are thinking about military medical support, what we are looking for? We're looking for a surgical search, a surgical aid, because into the battlefield we need this help. And unfortunately, the military medical systems are prepared for dealing with patients that are injured into the battlefield. We have a lot of surgeons, trauma surgeons, neurosurgeons, abdomen surgeons. We have orthopedic surgeons. We have a lot of capabilities developed in order to treat injured soldiers. But into these years, when we were preparing for these battlefields, we just put aside the biological threat, and all of a sudden, nowadays we realize that those military medical specialists that are ready for preventive medicine, for infectious disease, for treating patients with mild or severe infectious diseases are scarce. Because in most of the armed forces, we have dedicated the prevention medicine to our veterinary services. This is great because they're doing a great job. But all of a sudden, for the epidemiology, we really need physicians to start to look at the prevention required. We need what? We need people. We need trained medics for sanitary education to enhance, to support the health inspections and the public health services into the countries. And all of a sudden, we have observed the paucity of these capabilities. So I think that we have to think about this. From my point of view, I will say we are not prepared for coping with a biological threat.
Thank you. Thank you. We are almost to the end of our discussion, but I cannot finish our discussion, and actually we have a lot of questions. After that, we will pass to 3 questions. We'll choose exactly what the most interesting. But as a final word from our discussion, and I cannot miss this question, in order to increase the civilian and military resilience to the present and future biological threats, how we could analyze the most probable scenarios for pandemic development. That is, I know that is $1 million question, and I'm sure that we cannot give the exact formula, but the opinion is, I'm sure that it will be interesting for our listeners.
I think that I have touched a little bit of this question. The real problem is what? Our systems, both civilian and military, are not prepared with the staff. So the first lesson identified during this pandemic is that we have to increase the education and training of the entire medical staff. I'm speaking of a specialist, entire medical staff, what to do in case of biological damaging factor. In order to safeguard these medics, to safeguard their life and health, in order they to be prepared to support the patients to come. This is the first line. Our colleagues are not prepared to do with the biological threat. First. Second one, we have to educate ourselves. I'm speaking for the medical community. Not to speak when we are not a 99% sure what we are going to say. Because we are spreading misinformation, disinformation throughout the population, and thus we are impeding the real sanitary education of the population. This is the second. The third one, into the military medical environment, we have to shift a little bit our attention from the surgery to the prevention, to the preventive medicine, to the medical intelligence, to the resources for prevention, protection, identifying and coping with diseases to come. Another one is that into the military roles, we have to think about to whom we are relying on. Because we're saying, if there is a need, we will mobilize our reserve. But on the other hand, our reserve doctors are working into the healthcare system. So they are already mobilized by the healthcare systems. So if we rely on a possible mobilization of our reserves, we could face that the reserves are empty. So therefore, we have to increase the number of the specialists ready to work into the biological treatment environment. And what is most, but I would say it's not the least from the importance, we have to think about a pure military reserves of equipment to safeguard our own forces. Because in France, after a huge discussion, there was a proposal, and most probably it would be accepted, that the coronavirus has to be admitted as a labor-related disease for the servicemen, because they are front line. And if they are not protected, if the armed forces could not grant protective equipment for their servicemen, we will see a lot of casualties. What is more? What is the psychological impact? No one is talking about the psychological impact on the servicemen on these extraordinary duties. What I mean, our soldiers, they know that if they command, they have to sacrifice their life. They are ready. They have sworn about this. But now, when they are going on the front line, when they are facing this invisible threat, the burden psychological is, okay, I am sacrificing my life, but I could bring back home the infection and I could infect my family. The psychological impact has to be taken into account and into consideration. So therefore, as a bottom line, we have to think about two main issues. To grant to the armed forces reserves of equipment, protective measures, and workforce. And this could be done by increasing the education and training of entire staff on what they are supposed to do and how to cope with a biological threat. So I think that generally speaking, these are our way ahead, and I do hope that our policymakers and our planners will think about adjusting the educational and training plans for coping with this future threat.
Yes, thank you for actually that was all our questions for that discussions. I see that our audience is very active and we have a lot of questions. I cannot miss some of them. And just to continuation in your thesis from the last question, do you think that the military medical capabilities could be actively deployed in the very beginning of future pandemic? This is just an example for the future pandemic. It's obviously that this SARS change and mutate every year, and we should expect the new one.
So I think that this my statement will be admitted with an amount of angry. So I will make my colleagues that are on active military medical service very furious, but unfortunately for them, the real involvement of the military medical teams should be into the beginning. I know that we are at second stage, but when we are facing a new threat, if we do not intervene into the beginning, then our intervention will be with limited capabilities. And I'll give an example. The example is from China. The Population Liberation Army deployed 10,000 military medical staff into the first month of the epidemic breakthrough. So these 10,000 started their activities, and most probably because of their involvement into the early stages, we have seen almost eradicated biological hazard into the Wuhan and the town and into the Hubei province. Of course, there is no clear numbers of how many of these thousands were infected. I have seen, but these are not proved sources of information that almost 1/3 of them were infected. But this is a real. If we do not start from the beginning, our involvement will be as the firefighters. We are waiting a fire to come and then we're starting to extinguish. But into the medicine, there is a proverb. This, let's say, it's one of the bases of the medicine, of the medical art. The prevention is the best treatment. So if we want to stop, if we want to allocate the infection spread, we have to intervene into the beginning. Are we ready to do this? As I said, we're still not. We have to work on these scenarios. But I think that in, let's say, most of the countries, the heads, the surgeon generals were involved into the planning. So I think that they have taken their notes, and most probably from the autumn or from the beginning of next year, we will start to move into this direction.
Yes.
I think that I have
Yes, definitely you answer, but you answer from point of China's experience. I would like now to switch to another example about what is your opinion for the so-called Swedish approach for dealing with the virus infection, because I think that they are completely different two approaches of China and Swedish.
I think that there is no need for my answer. You just go into the work methods, look at the numbers of how many of the persons were infected for 1 million of population and how many of them died. And if you compare these numbers with the numbers of the other countries where the restrictions were imposed, I think that we will give you the correct answer. But I will say that we in NATO, we have a good example of the involvement of the military medical capabilities. When the Luxembourg asked for support, 1,200 square meters of tents were built as a field hospital, and it provided 200 beds. What else? The NATO put a lot of effort into the transportation of equipment, of consumables, of pharmacy deliveries through the countries. So we were involved, but I think that the involvement should be from the beginning, because unfortunately the military medical teams proved to be more prepared as standard operating procedures, as a dealing with this new invisible threat. So this is my point of view, that most probably not into the first day, but within the first week, we have to step into the healthcare system response to the biological threat.
Thank you, but I cannot miss this question. I'm sorry for our listeners that a little longer is our discussion, but I would like also to ask you about the opinion about the common approaches, because we saw in the beginning that European Union and our allies in NATO I could say that was not so prepared about how to react as a common approaches for the European Union, for example, as an allies. And secondly, do you believe that in near future the European Union should have some kind of common procedures for the whole European Union countries? And what will be happened, what should be approach of the European Union if some of the countries do not follow the restrictions and guidance from the European Union or NATO, of course?
Here I'm really into a crossroad. Why? First of all, there are a lot of evidence that some of the countries ask and receive medical support, and this support was given by military medical teams. What I mean, the Northern Macedonia received a lot of protective equipment from Croatia, for example. Albania provided military medical teams to Italy when this was asked. Germany opened their hospitals for receiving trains with casualties from France. A lot of goods were transferred. A lot of protective equipment when produced into the countries that were spread within the European Union. And I think that these green corridors that were opened between the closed borders within the European Union are clear evidence that our policymakers started to think about the way ahead for coping with such shortfalls. But here we have a biggest problem with the acceptance of a military medical support. Because when Italy asked, and when Italy was in a real dire situation, especially into the Lombardy, it is a shame for us. I'm sensing this as a shame, because who helped Italy, Italian healthcare service? Who helped? A Russian military medical teams and a Chinese military medical teams. They were first there to step in. What does it mean? That we still have to work on this. And what else? We have to have a clear in NATO doctrine that a military medic that is with acknowledged rights to work in a NATO country in a case of disaster should be admitted as a national doctor to the other country. What I mean, a Bulgarian military medical doctor should have a right to treat a German citizen in case of disaster. I think that here is the right way, because now I'm going back to Sweden, because Sweden, Norway, Denmark, they have made an agreement that in case of urgency, in case of emergency, teams from these three countries who work without any obstacles into other countries. And I think that we should take this example from our northern colleagues and to implement this best practice into our doctrine.
Yeah.
I think that this is the future into our...
Yes. Yes, thank you very much. Exactly what that was the answer what I expected, that the European Union and our allies and we as allies, we should develop our own doctrine, concepts, procedures, common, and first to manage in our European Union, for example, countries, and after that to continue how to deal with the countries which are outside. Even in order to stop that kind of threat, we should maybe help to other countries in order to spreading of the virus inside the European Union or our allies country. But really, really final questions, and I expected maybe some kind of short answer. If there is no defined course of action to treat the people with heart health conditions, how we can talk about a successful vaccine? As a medical person, maybe you can answer this question.
Once again, question is fold. You're asking me regarding the treatment and regarding vaccine.
Vaccine.
So, vaccine for the coronavirus, a specific vaccine, because into the biological area of damage management, we have two types of immunization. One is passive and one is active. Passive immunization are those that are providing a tool that are enhancing the immune response to be ready, to be prepared for the attack. Here we could expect a vaccine. And all those vaccines that I have mentioned, into the Russia, into the China, into the England, into the UK, these vaccines are of this type. They are increasing the passive immunity. They are preparing T cells for act against the coronavirus attack. But they are not a specific vaccine. And unfortunately, from my point of view, a real active vaccine that is specified specifically for the coronavirus, we could not expect to be developed into 3 or 4 years' time. Why? Because one of the characteristics of the virus that I didn't mention into the beginning is the high mutation rate. This virus is with mutagenic capability higher than the HIV virus. And you know that the vaccine for HIV, for the AIDS, is still not developed after 20 years. So what I expect is to have a vaccine that will enhance, that will passively immunize us and prepare us for coping with the virus. And regarding the treatment, if we do not know what exactly is the pathophysiology, we could not treat it adequately. For time being, the last approved by most of the scientists is that the coronavirus is attacking our vessels. So we have vasculature. All the capillaries are affected, and therefore a lot of fatalities are related to the heart and the vessel diseases, not only for the chronic pulmonary diseases. So if we have a vasculitis, then we have to think about something that is preventing the damage to our vessels. But this is still under the development. So till now, no answer.
Yeah, I know that we don't have an answer, because if we have an answer, we will stop talking about the COVID as a threat. That was actually the last question. Just before to stop this very productive and very fruitful discussion about the COVID, I'll give you the floor if I miss some question, and if you want to mention something to our listener, our watcher, and to tell something to our audience in short, and to maybe to share your materials or something like this.
Okay, thank you, Director, for this opportunity. What I would like to say that I'm ready to answer all the questions.
We will provide it.
Could be received. So I'm providing my email to the Center of Excellence, and I will answer to all questions, and I'll be happy to answer them. And if you want a specific topics to be discussed with me, I'm ready. And for the other listeners, now I will share with you the small presentation that I prepared for, just to sum up, in this presentation could be, of course, downloaded from your SharePoint. So now this is the agenda. I think that we have discussed all these things. Some basic information regarding the coronavirus, what and how the armed forces were involved. You can see the bullets I have already discussed with you. Here are some examples from Italy when they're making a cordoning. Here we have a very fresh example from South Africa, and as you can see, the armed forces are performing the real tracking, and they're imposing the restriction. This is from this picture is from one day. This is the NATO involvement regarding the delivering of the goods and the medical consumables, and this is how we are teaching our civilian colleagues what to do and how to do regarding the decontamination and the protection. Now I'm speaking that the bringing forward capabilities, the medical support, that is the most important, the managing the triage centers, field hospital, the ambulances, the admittance, everything that we have already spoken with. Of course, I have forgotten the transportation of the teams, because we have allocated a lot of our teams into the different hospitals. And here are some more examples. This is the NATO field hospital in Luxembourg that was built after the plague. This is the example for the UK Armed Forces building the huge and extremely well done field hospital. This is how in Spain they are performing the bringing of the goods. And of course, I'm giving some examples how the forces were implemented, or how they intervene. You see how many servicemen and women are involved in different operations into different countries. Here is the international. I have forgotten the Bosnia and Herzegovina that have received medical supplies. And now here I'm coming for the medical challenges. And one thing that I want to speak, and I forgot, this is the exhausting resources nowadays into even to the medical teams, reservist policy and everything that I have. And the last one is the answering of your question. What I think that should be done in order to be ready for the next epidemic or for the next wave of this pandemic. Okay, if this presentation is of interest, it could be downloaded from your site. I will say
Yes.
out. Okay.
Thank you.
And really, I'm expecting a lot of questions. I do not want to stop the discussion now, but I see that we are out of time. So please excuse me, but the professors are like this.
It's normal, yes, of course. Thank you. Thank you once again for your participation. And I'm sure that that is not the last time that you are our guest. Actually, our invitation is because on our website, every one of our listeners and readers and spectators can see also our bi-weekly reports, which we have been prepared from the CMDR COE staff. And I invite you for our next edition of a report for next Thursday to provide your opinion on the 3, 4, 5, 6 pages. It doesn't matter how long it will be, and we will include your thoughts in our reports for the next week. Thank you one more time to all of you, and for your patience to be 1 hour and 15 minutes online. I would like to say you goodbye, and I wish you to stay safe, and see you next time very soon. Thank you. Thank you. Bye.